Denied claims are costly because they delay or permanently reduce revenue. It increases administrative expenses, strain operational resources, and elevates compliance risk. The reality is that most high-volume denials are preventable. Today, we're going to walk through denial reasons for each line of business. We'll talk about what typically triggers these denials and, most importantly, share practical tips you can use to help reduce them going forward. This graph highlights the top 5 denial reasons by line of business for the period October 1, 2024 through September 30, 2025. The data includes the denial code and definition, as seen in your readmittance report. Percentage of denied claims are listed in order from the highest to lowest type of denial. Due to time constraints, we will only focus on the 2 denial codes driving 75% of denials. COB denials have more administrative errors rather than clinical. These denials are common because even minor COB data issues, such as coverage dates, plan names, or subscriber IDs, can trigger a denial. Let's take a look at 5 denial triggers and tips on how to prevent COB denials. Number 1 trigger. Medicaid is payer of last resort. Other insurance exists but was not billed first. Tip: always submit claims to the primary payer first. Claim can then be submitted to the secondary payer after primary payment or denial has been received and a valid EOB is available. Number 2 trigger. COB information is incomplete or missing. Common data issues include missing or incomplete coverage dates, policies that have terminated but were not updated, or unclear subscriber relationships. Tip: update coverage when insurance terminates or a member becomes Medicare eligible. Correct any discrepancies promptly in practice management systems and payer portals. Third trigger. Eligibility was not verified at the time of service because the member gained or lost other coverage near the service date, and retroactive eligibility updates were not captured. Tip: verify eligibility for every date of service. Confirm active coverage and identify all insurance policies. Fourth trigger is missing or invalid EOBs. This occurs when the primary payer's EOB is required but has not been attached. An EOB may also be considered invalid if it does not match the claim details, including the dates of service, billed charges, or the CPT or HCPCS codes submitted. Tip: attach EOBs when required. Secondary claims should include the primary payer's EOB or electronic remittance advice. The fifth and final trigger is system or payer record mismatch. Provider system shows no other coverage, but the payer system shows active primary insurance. Tip: monitor and trend COB denials by tracking high-volume clinic or office locations. Analyze denial patterns to pinpoint systemic issues and opportunities for improvement. Use these insights to guide targeted staff education, implement system edits, and make workflow changes that reduce future denials. For this last section, we will review 4 main reasons why duplicate denials occur and provide tips on how to prevent them. The number 1 trigger is premature resubmission. If a provider resubmits a claim because payment is delayed, before the original claim is finalized. Tip: always submit corrected claims as replacements, not originals. This prevents the payer from interpreting adjustments as new claims. The second trigger is missing or incomplete modifier. When the same procedure is legitimately performed more than once, same day or same encounter, failure to append appropriate modifiers can make services appear duplicative. Tip: ensure coders are trained to apply repeat, distinct, and bilateral modifiers consistently and supported by documentation, especially for same-day services. Third trigger is lack of internal coordination. Lack of internal coordination may result in duplicated billing when different departments submit claims for overlapping services for the same patient and date of service. Tip: align workflows between departments, such as lab, radiology, professional and facility billing, to prevent overlapping submissions. Finally, trigger 4 is COB confusion. The primary payer processes a claim and automatically crosses the claim over to the secondary payer for additional consideration. If the provider is unaware that this crossover has already happened and submits the claim separately to the secondary insurer, the secondary payer may identify it as an exact duplicate and deny it. Tip: providers can reduce these denials by verifying primary and secondary coverage before billing, confirm whether a claim is crossed over, allowing adequate processing time before resubmitting, and using payer portals to check secondary claim status prior to submission. Understanding why a claim is denied is important to strengthening overall revenue cycle performance. Thanks for joining. Please contact our provider educator for any additional questions.